Good afternoon, ladies and gentlemen. Can I ask those of you who are here for the final session to take a seat or to loiter with intent at the back on the nice stools? And if you have any mobile device, on silent, tweet nice things or don't tweet at all. My name is Anne Godfrey. I'm the Chief Executive of CIHE, and I'm here to chair the final panel of the day. And I and my fellow speakers are well aware that we are keeping you from either the trek home or networking, otherwise known as the bar. So we will try and be engaging and fun. You don't get off that lightly. You get to be involved as well. We have been set homework. So a couple of warnings. You are being filmed. You will be asked to ask questions. You will be asked to name yourself, who the question is for. If it's the whole panel, say so, but keep it polite, people, because it's all on candid camera. And at the end of this, me and a purple pen and blind person is going to try and summarize 3 recommendations and 1 challenge to government of how we can actually build healthy homes, factories, hospitals, schools. Basically, let's make the built environment sustainable and a healthy place for all of us to work, live, and play. With no further ado, I'm going to introduce briefly each of our panelists. You will notice it's a little bit smaller than we'd expected. So I have 2 sets of apologies to send. One, not really a surprise. Our MPs are a little bit busy with the B word, and that's as much of the B word as I can stand, quite frankly, today. So Jim Shannon has sent his apologies, but he's doing his day job. At least he is. Moving swiftly on. And Sani Dimitroulopoulou, unfortunately, because I've been practicing her name for 2 days, isn't here, does send her apologies, and we have got a stand-in because Emer, who I'll introduce in a minute, is going to do what she would have done. So nearest from me and across to your left, she said, hopefully getting left and right correct, we have Emer O'Connell, who is a consultant in public health with Public Health England, or the HSE, I think. HSE? Public Health England. We have Charlotte Clark, who's an associate with Arup. We have Oliver Heath from Oliver Heath Design. Some of you will know him from the telly. Sorry, it had to be done. Sad middle-aged woman who used to watch you. And then Anne-Marie Aguilar, who is the Director of Operations Europe for the International Wellbeing Institute. So I am in a minute going to ask them to come up and tell us how the 90% of our time we spend in buildings can be healthier for us, save our NHS money, and make sure that we are not inhaling or listening to or living in fabrics that damage us. And the first up is going to be Emer, and I will now do the slightly fuller biography before I take the glasses off. Am I allowed to read out who you are, or shall we? You can do it yourself.
No, do it yourself.
This will be fine. This is the bit where you move on to page 2 of the purple ink. Emer leads the Extreme Events and Health Protection team at Public Health England. She's a consultant in public health specialising in environmental public health issues, including air quality and climate change. She has a Master's in Public Health from the London School of Hygiene and Tropical Medicine and a PhD in Public Health and Population Science from University College Dublin. Emer.
Thank you. So I'm going to start off by delivering Sani's slides, so please forgive me. I'm by no means an expert on indoor air quality. And Sani was very apologetic that she couldn't be here, so she's very keen to answer any questions you might have. So if you have a question for Sani, she's asked me to take down your details, and she will personally email you back and talk to you on the phone if need be. Okay, so I'm going to talk about the health and well-being benefits from providing good indoor air quality. And I have to work out how to do this clicker now. No. So starting out from the big picture, this really shows the various interactions of the housing environment and how we need to look at the risks and the hazards and the benefits associated with those. And you can see that this covers indoor air quality, ventilation, indoor overheating, noise, and how all of those various things interact. And the reason why it's called the big picture here is because overarching all of that is the issue of climate change, which when we are assessing risks for now and building homes for the future, we need to also consider the impacts of those. So why are we concerned in Public Health England about indoor air quality? Well, there are some known and evidence-based health effects, both in the short term and the long term. In the short term, we can see irritation of eyes, nose, throat, headaches, dizziness and fatigue, and these are primarily due to VOCs, which are the volatile organic compounds. Largely, these are things like formaldehyde, and the sources of those would be furnishings, but also household products like cleaning sprays or even beauty products like hairspray. and candles and things like that. So we've also seen cognitive ability is also affected, and this is indicated through links with carbon dioxide. So it isn't the physiological impact of the carbon dioxide exposure itself, but carbon dioxide here and high levels of carbon dioxide in the indoor environment are indicative of wider indoor air pollutants there, which might not be so easy to measure. So the likelihood of these effects on the health depend on age, pre-existing health conditions, individual sensitivities. The range of sensitivities can be from very, very insensitive to hypersensitive, and repeated exposure or high levels of exposures. So we also see impacts of indoor air quality on effects on work performance. So this is quite an old study, but there has been updated evidence on this, and you can see as ventilation rates increase, the productivity and performance has increased. But obviously this is a hypothetical curve, because if you were to increase the ventilation rates to 45 litres per second as demonstrated here, obviously that would have implications for energy efficiency. But according to there was a very wide study done called HealthVent, which was a multi-centre European study, and they assessed and modelled. They conducted studies across different office-based and domestic premises looking at ventilation rates and indoor air quality and self-reported symptoms, and they identified that the minimum ventilation rate for ensuring the WHO guidelines for indoor air quality was 4 litres per second per person. This is very much veering into work that's not my expertise, so bear with me. And this evidence has since been updated by the work of Rajat in 2018, where they demonstrated that the environmental conditions, particularly temperature and CO2, again, CO2 here is an indicator of more of the wider indoor air pollutants, that they can have effect on productivity and performance. So the conclusion here is that optimizing the indoor environment in both existing and new buildings will enhance workplace performance and productivity. This is also true for the school environment. Children's performance did improve with ventilation rates, and as a result of this evidence, the Department for Education has written some guidelines on ventilation rates within the teaching environment, and those suggest that the recommendations for design is that their ventilation rates of 8 litres per second per person should be the standard for teaching spaces. Again, this is ventilation as used as an indicator for indoor air quality. So the longer term effects, it's great difficulty in estimating the true health impacts of these long-term low-level exposures, but as they might turn up many, many years after initial exposure, and they're usually cumulative. So these would be things, indoor air pollutions that have occurred as a result of incursions from the outdoor environment largely, and that would be traffic-related pollutants and so on, as well as radon. So the health outcomes that we associate with poor indoor air quality are respiratory diseases such as asthma, chronic obstructive pulmonary disease, which is a very debilitating condition and progressively gets worse, reducing the quality of life of people who have it. Heart disease, cardiovascular disease, which is a very common health outcome, and it can be exacerbated, and poor indoor and outdoor air quality is a contributing factor to cardiovascular disease, and cancer, such as lung cancer. So this HealthVent project is the European project I spoke about earlier, and they looked at the contributory for how those indoor air pollutants, the different types, contributed to the overall burden of disease associated with the indoor environment. And you can see here that the largest one in red, where's the screen? That's PM2.5, and a huge proportion of that, over 60%, is outdoor air pollution, and that's largely from transport and other sources. So you can see that this is an interaction between the domestic environment as well as the outdoor environment, and relates directly to ventilation rates, which also relate directly to indoor overheating and also to noise. So Sani's message when she talks to us, when we work together, and when she talks to government as well, is all about this holistic approach. The indoor air quality problem can't be seen in isolation. It has everything to do with indoor air pollution, outdoor air pollution, overheating, noise, and all of these things that are linked to health and well-being. So it's truly a cross-government issue, and that's how we see it within Public Health England. And the good news on what is happening in government is that there is a cross-Whitehall collaboration to review the building regulations, and within that group there are indoor air quality, indoor overheating experts, noise experts, and a range of other people involved in those discussions. So I think that we're beginning to see more of this holistic view of how we develop guidelines and regulations that look at the housing environment as a whole, so we don't have those unintended consequences where we regulate for one thing and make another thing worse, which has been traditionally what has happened. So this leads me on to something I'm a bit more familiar with. I'm going to talk about the health impacts of high temperatures. So why are we concerned about heat? Everyone loves heat waves. Whenever we hear it in the news, people see it as a really positive thing. And when people think about the negative impacts of heat on health, they generally think about heat stroke, or they think about heat exhaustion, which is, where you get a headache, you start to become dizzy, you start to feel very dehydrated. And that's the point at which it's very reversible. You just need to get your body cool, go into the shade and rehydrate, and you will be fine. It's when that moves into heat stroke where we start to see a medically critical condition where hospitalization is required, and that's when you, instead of seeing the sweat on the skin might be dry and very hot. People might be very confused and they start to lose consciousness, and that is a critical medical emergency. But we see about 2,000 deaths every year where heat and exposure to hot temperatures is a contributory factor. And of those 2,000 deaths related to heat stroke are a tiny, tiny minority. The health impacts of heat, as we know it, and as Public Health England is concerned about, are the impacts on cardiovascular and respiratory mortality. So we see deaths. And those deaths are largely in elderly people, but they can happen at the younger age groups as well. So the reason why we see that exacerbation of cardiovascular mortality and stroke is because when your body overheats, the blood starts moving to the peripheries and towards the skin, which puts a strain on the heart. And if you are older, or if you have a condition or on medication that makes your heart compromised, then you are more likely to have a cardiovascular event. And that's where we see that big bulk in mortality. It's not around heat exhaustion, it's not around heat stroke, it's not about people going out in the sun and having a good time during the summer. It's about people dying of a cardiovascular event in their house. So bear with me with this graph. It's quite complicated, but it really demonstrates where it relates to people who are working on housing and the built environment. If you think about the fact that most people spend, especially people who are elderly, spend up to 90% of their time in the home. I'm going to talk about the threshold of heat where we start seeing those health impacts in terms of increases in deaths. So on the relative risk axis there, that's the increasing risk of mortality. And on the lower axis, we have the distribution of temperatures across, this is for London. So you can see there that most of days during the year, you have moderate temperatures across the bottom scale there. And you see as the temperature goes up towards around 24 degrees for London, you see that the line there that goes from blue to red starts increasing, and that's where mortality starts to go up. So you can see that the threshold at which deaths start to increase in London is about 24 degrees. That's not a temperature that you or I would think of as being even moderately hot. We'd say it's kind of a day where you take your jacket off in London. But that's the point at which we start to see this increase in deaths across the population. And obviously that starts to go up and up and up as the temperatures increase. But really, the burden in terms of the number of deaths, because these moderately hot days are far more frequent, the majority of the burden is at those days which are a bit hot, but not extreme. So by the time we get to a heat wave, actually, most of that mortality has already happened on those more moderate days. So in terms of prevention, it's really around our focus shouldn't be on going to visit people who are living in hot houses during extreme weather events and heat waves. Our focus should be on building homes where people are protected during those moderate but very frequent days. So that's really the challenge for you guys. So who are we talking about when we think about people who are at risk? Well, it's actually quite a lot of people. So obviously older age, if your heart over the age of 65, unfortunately for those of you who are over 65, your heart just is not as effective as it used to be. People with chronic and severe illness are also at risk, whether that's due to the physiological impact of their illness or to the medication that they're on. Inability to adapt behavior to keep cool. This is a real problem. We see it in all of the evidence that we collect. Often people who have maybe early onset dementia, they're not able to identify that they're overheating. Even as people without any other condition age, their ability to thermoregulate and to identify that they're overheating becomes compromised. But also, if you have early stage dementia or you have some other inability to adapt your behavior, it means that you're not going to change the way you dress. You're not going to change your environment, i.e. your home, to keep it cool and to keep yourself cool. And there are the other factors, such as the environmental factors and overexposure. But in general, these exposures are happening within the home. And the other thing to note about, there's a difference between the risk to health from heat and the risk to health from cold homes, which I'm sure you know quite a bit about as well. But the issue with overheating is that these deaths happen very, very quickly. With cold, you see a lag trajectory in terms of the cold snap. There's about a day, between 28 and 40 days, you'll see an increase in deaths across the time period, whereas with a heat wave or an increase in the temperature, the ambient temperature, you'll see within 12 to 24 hours of the temperatures going up, the deaths will start to happen, and they happen within that 24 to 48 hour period. So in terms of our ability to respond, it's virtually zero. There's not a huge amount that your local authority emergency responders can do. So this is an overview. The higher temperatures will increase the risk of overheating in houses, schools, hospitals. We know we have a very specific issue with care homes in particular, prisons and other types of buildings with very identifiable impacts on health. There's a lot of evidence accumulating now that people don't adequately assess their own risk for the impacts of overheating. That's elderly people in particular. They don't understand and they don't acknowledge that they are at risk simply by being over 65. We have real difficulty in identifying a safe threshold for heat for health. We know that there are definitions around thermal comfort, but that is separate to a threshold based on health. That's to do with some really significant methodological challenges. We have tried very hard. And this risk to health from high temperatures, and specifically around indoor overheating in domestic and other premises, has been identified as a key priority within the Climate Change Risk Assessment 2017. So it is a priority for government at the moment. So Public Health England is very active in this space. We have identified that it is a key priority, and we are one of the key government departments with responsibility in this area. So we've identified some key resources for the public, as well as for key professionals, people who work in care homes, people who are carers and go out to domestic premises. And these are some of those that are available from our website. And we have also developed a Keep the Heat checklist for domestic premises. So that describes what sort of homes are at risk, what sort of people are at risk, and sort of actions you can take before the weather gets hot, because actually most of this stuff needs to happen when a home is identified and an individual within that home is identified as being high risk. You have to take those preventative measures first and put measures in place so that the house won't overheat in the first place. Okay, that's it for me. Thank you very much.
Thank you very much, Emer, and thanks again for being both Emer and Sani. Brilliantly done, especially as I think you only saw the slides for the first time about an hour ago. Yeah. So can I introduce our second speaker? And I have to decipher my own handwriting in purple, so apologies to Charlotte. Can I introduce Charlotte Clark, who is an associate with Arup, psychologist and epidemiologist. I practiced the wrong word, didn't I? Should have practiced the job title, not the title. Never mind. Whose research focuses on the noise impacts on health and well-being and applies this knowledge to higher impact assessments for transport and large infrastructure projects. I'd like to introduce you to Charlotte. Sorry about that.
No problem. Thank you, Anne. So I'm going to talk to you briefly about noise impacts on health. And just before we get too far down that road, it's just important to have a little think about when does sound become noise, and to try and understand how noise is actually measured. So this scale here shows you various different noises on the decibel scale, and it's fair to say from doing a lot of public consultation that this is not a scale that's well understood. So you tend to find the sort of, obviously the higher the noise up the decibel scale, the worse it is for you. But actually at around 55 dB decibels, that's around where the European laws come in. That's seen as a threshold really for where there might be adverse impacts of noise on health. And so you can see that actually on this scale there are very few things that are below that level. I think it's fair to say that's a fairly low level. I wouldn't be surprised if the background noise in here at the moment was around that level, but I'm not saying that's bad for your health. So you can see when you start to think about transportation as an example, that actually most of our transportation, if you live by a road, you would be above 55 decibels over the day on an average. And so you can see the challenges actually of trying to build housing when we all want to have access to transport, not just cars, railways and other things like that. And so just this isn't to bring up Brexit, Anne, in case you're worried, but I've got some EU numbers here just about the number of the population in Europe who are exposed above 55 dB. And that LDEN, that's a 24-hour measure of your exposure to noise over the day, evening and night. And you can see that we have over 100 million who are exposed to road traffic noise, 19 million exposed to railway noise, 4 million exposed to aircraft noise, and around 1 million who are exposed to industrial noise. So this is quite a hefty population when you think about these numbers. And I just also wanted to say that we're very focused also in noise and health research on quiet areas as being good for you. And this research suggests that around 18% of Europe can be classified as quiet. And so how does noise influence health? Well, I've been for the past 20 years working in noise and health research. I think it's fair to say when I started, you were seen as a little bit cranky and unusual and a bit peculiar. People didn't really accept that something like noise, physical noise, could affect your health. But over the past few years, it's certainly been shown that noise not only affects things you might predict, so for example your sleep, if you've got noise at night from airports or railways, that's not good for your sleep. Sleep's obviously important for your health in lots of ways, but there's also increasing evidence that noise is not good for you in other situations. So for example, evidence that noise at school, if you're exposed to aircraft noise at school, that impacts on children's learning. And also affects if you live near something that's very noisy, you start to get stress responses. And a lot of policy in the UK is based around what we call annoyance responses. So these are where you live next to the noise and it's very stressful for you and that can affect your health. And it also now there's evidence that if you work through that sort of biological stress response all the way down, you can end up having cardiovascular reactions to noise. And over time, if you're exposed to many years, there is evidence that it can lead to things like high blood pressure, heart attacks, stroke. So noise is now accepted to have ranging from, sort of stress responses through to more quite serious health impacts. And so just to talk a little about the World Health Organization, they estimated what the burden of disease was for environmental noise for Europe. And they estimated that there was over 1 million healthy life years lost every year because of noise, and that most of these impacts were actually via either noise annoyance responses or noise effects on your sleep. And so a lot of my work now is dealing with people who are exposed to environmental noise and thinking about how you design for that. So wherever you want to really build new railways, have airports, want to put up a wind farm, the communities will have a reaction to that. And more you're seeing that people are aware of these health impacts of noise and they will use them to campaign against developments. And just wanted to briefly mention that in England, the noise policy statement for England does deal with this issue, and actually you have to, when you have developments like this, try and avoid significant adverse impacts on health and quality of life. You have to mitigate and minimise these effects where you can. And if possible, they also want you to try and improve these factors where you can. So the noise policy statement for England takes these health and quality of life impacts into account. And then I was asked during this talk just to talk briefly about what this might cost. So what might these noise and health effects cost the UK? And I found this paper which looked at what the impact of environmental noise on hypertension, which is high blood pressure, and other health outcomes like stroke, vascular dementia, and heart attacks. And they found that each year in the UK there are around 500 additional cases of heart attack related to hypertension, about 800 strokes, and around 1,200 cases of vascular dementia. And they valued those, the impacts of those extra illnesses at just over 1 billion. So in terms of what can you do about environmental noise, very focused that the environmental noise is external. Obviously most people, as Emma said, are in their home for a lot of the day. And so I just wanted to finish up on a more positive note, thinking about what we call good acoustic design. And so this comes from the Pro-PG guidance, which was published, I think, about 18 months ago, which encourages and actually is a good guide for people who are local authorities trying to review developments to see if they're appropriate in terms of how they're treating noise and health impacts. And so these examples really just show you how where you can place the infrastructure that you're trying to put in the environment and how you might protect the residences. So for example, the left-hand side, it's not only got a bund, which is a mound of land designed to sort of absorb the sound, but also you can place other things like offices between, say, the road, the railway, and the residential block. And the right-hand example actually is what we're very often seeing these days, is that people are squeezing housing in next to railways or bits of land that have not been used. We're not against that, but obviously in terms of acoustically designing, that's quite challenging. And this just gives you an example of actually the use of winter gardens. So winter gardens are a closed-in balcony that have louvres on them. So you not only therefore insulate the glazing of the housing unit, but you also then have a balcony that's part insulated as well. And so for people who are exposed to quite high levels of noise, that can be an efficient way to try and mitigate the noise. So that was all I had to say today, but I guess just finishing on good acoustic design and going back to Emma's talk on overheating, it's important to realise, and this Pro-PG guide highlights this, that it's not just about acoustically sealing the building, because you need to have good ventilation in there as well. So it's thinking about all of these things together. Thank you.
Thank you very much. And on to our third speaker, and I'm only going to do one paragraph, because of all our speakers, it was the longest biography I got. So I'll stick to the bit I've got at the front. I'd like to introduce again Oliver, who is founder of Oliver Heath Design Limited, an architectural and interior design practice focused on delivering health and well-being in the built environment through evidence-based, human-centred design. And specifically today, we're going to find out the meaning of the word biophilic when applied to design. Oliver.
Thank you very much. Okay. Okay, so thank you for the introduction. My name's Oliver Heath. I'm an architectural and interior designer. I run a design practice down in Brighton where we specialise in health and well-being and biophilic design. We also have a research section where we pull together all sorts of different research studies around health and well-being. And over the last 20 years, I've been discussing how we can encourage people to take up sustainable design in their homes and buildings and offices. And over the last 5 years in particular, slightly shifted my focus towards how we can encourage and engage people around the ideas of health and well-being. So what I'm going to tell you about today is some of my experiences of how I've perhaps successfully done that, and perhaps also how I failed over the years, and the roots and some of the learnings I've found of how to engage people to actually adopt health and well-being and the frameworks that exist into the buildings that are so important in their lives. So first up, we've got to explain the problem to people. I think people are conscious that health and well-being is an issue. We're seeing the issues of air quality and junk food all around us all the time, but we've really got to get these messages home to people. There are some incredible statistics that really demonstrate things that I'm sure we all already know. Stress-related illnesses of cardiovascular disease and mental health issues are likely to be the 2 prime contributing factors to illness by 2020. A health and safety executive study that came out in 2018 stated that stress accounts for 44% of all work-related ill health cases and 57% of all working days lost. We have very high levels of urbanization, which on the one hand is good. It helps us to be a little bit more sustainable. That is a fantastic figure, isn't it? A great round of applause from the neighboring stage. Thank you for that. But also it means that we have a disconnection from some of the things that we know make us feel good. And as well as that, we have ever-rising levels of technology that tend to distract us and mean we don't really give ourselves the opportunity to relax and to recuperate in the way that we should be. And what does this all mean? Well, over the last 20 years, a lot of the conversation around sustainability has been very carbon-focused. It's been about our use of gas and water and electricity, our use of materials and the circular economy. But trying to engage people in this conversation is a really difficult one, and this chart explains exactly why that is. Because actually, for the majority of organizations, energy, such as gas and electricity, is only 1% of typical business operating costs. But by contrast, when we talk about the human-centered costs, then actually 90% of typical business operating costs are in staff salaries and benefits. So starting to help people understand the real cost of human occupation in buildings is really important, and I think an essential component of the creation in sustainable buildings. So how do we get people to engage in that idea that nature is good for us, that we want health and well-being? Well, I think it's an interesting subject. You know, as I've experienced over the last 20 years, people can kind of take it or leave it with sustainability. You know, they kind of know that it's happening, but it's happening somewhere else. But slowly and slowly, of course, it is coming home towards us. So what I always try and do is try and engage people in a similar level of conversation, and that's really around health and well-being. And the difference is that not everybody gives a damn about sustainability, amazingly, but everybody wants to be happier and healthier. And once you get that on board with people, it's actually a very, very similar conversation that we can be having, and to deliver sustainable buildings that create healthier places to live. And in part, that's because inside all of us is a genetic inheritance that has come up from human evolution that suggests that we've evolved, survived, and thrived in healthy forms of nature. And as a result of that, within all of us, we have a sense of what we call biophilia, which is an innate attraction to nature and a desire to be near it. So if I was to ask you all to imagine for a moment a place where you feel happy, calm, and relaxed, there's a very good chance that the space that you're thinking of right now is not the place where you work or the place where you live, but actually a place surrounded by nature, probably a place with water, trees, greenery, mountains, sky, and sunlight. So within all of us, we have this connection to the natural world. We've all had positive experiences. And for me, the conversation around sustainability and health and well-being is about keying in to these really emotive messages that each of us individually have had positive experiences of, and build from there. Now, that idea that we've evolved in very close connection to healthy forms of nature has developed into something called the savanna theory, which suggests that we actually have a physical preference for observing landscapes from a point of prospect and safety. Landscapes which are lush, green, and healthy. And when we see these landscapes, they have the ability to reduce heart rates and blood pressure levels. So innately within all of us is ability to observe nature, and for that nature to have an emotive and physical response to our physical health and mental well-being. So this idea behind the Savannah theory suggests that we're very good at recognizing healthy spaces. The challenge really is how we bring these ideas of an emotive and positive connection to nature into the built environment. Well, luckily, we have a number of different frameworks that have been developed over the last 20 years that help us to bring health and well-being into the built environment, that improve that connection to nature. Now, most comprehensively, we have the likes of the Well Building Standard, which Anne-Marie is going to tell us a little bit more about in a minute. Essentially, it's a well-being standard, much like BREEAM or LEED, but that really focuses on the investigation, the certification, and the ongoing occupation of healthy buildings. It's been in operation since about 2014, and essentially within it, there are a number of key concepts, 7 concepts, that really help us to understand how we can deliver improved health and well-being in a number of different places. At the moment, these places tend to be more workplaces, but it is starting to spread. So the well concepts go from air quality, as we've heard already, water quality, hydration, and the types of water we're drinking, the serving and delivery of food, natural and artificial light. Fitness is really about how we get people to move around buildings, physical comfort, things like ergonomics, acoustics, and thermal issues, and also mental well-being. Now, within all of this, a number of these are quite kind of elusive subjects that might be more akin to a subject that an engineer might be a specialist in. But as we move down from air to the mind section, there are more and more opportunities for designers like me to introduce design features that can enhance and support mental and physical well-being. And in particular, in number 7, we see that biophilia exists, that idea of improving that human connection to nature. And what's exciting about biophilia is that it's a very accessible idea. It's an idea that many of us can very easily grab hold of. Now, within biophilia, we have this framework called biophilic design. Now, within this, we have 3 different aspects. We have a direct connection to nature. That's all about how we bring real plants, trees, light, and water into buildings. Natural analogues is about how we mimic or evoke a feeling of nature using natural materials, colors, textures, and patterns. And the human spatial response is about how we create buildings that are exciting and stimulating and energizing and aspirational, but equally create buildings that are calming, relaxing, and restorative. Now, these 3 ideas have been developed into what we now call, in the most accessible form, the 14 patterns of biophilic design. And this is essentially a framework that allows us to pick and choose a number of different features that we can bring into buildings to create spaces that help us to focus and work and concentrate, or to socialize, to be more communicative, but also to create spaces that are calming, relaxing, and restorative. And to create good, sustainable buildings, we need just not only the carbon-centric approach, but also many of these more human-centered ideas. So the next thing, how do we really make these ideas accessible? Because we all know we want to be happier and healthier. We know there are issues around air quality, around water quality, about temperature, humidity, but how do we actually engage people in this? I mean, this is a really tricky subject because for a lot of people it just simply comes down to cost and effort, time frames, building typologies, or project teams. So in my organization, my company, we do a lot of work around how to make these ideas accessible and exciting, how to help people recognize that biophilic design opportunities exist all around us for very, very little money. So we create projects and research studies that really start to investigate this from 0 to low cost, medium to high cost. And here we see 2 very different scales of this idea, helping organizations to understand that it's the simple things, but also it may be about how you spend money more wisely as a means to attract talent, to increase productivity, to increase communication, and to retain staff. So we've been working on this idea, and what we've done is we've created a series of different scales from low cost to medium and high cost. The low cost things are the things that we can do to existing buildings for very little money. The medium cost are what happens when we undertake these ideas for refurbishment projects. And high cost are looking at some of the incredible materials, textures, technologies that are available to us today. Now, if you'd like to know more about this idea, we've created a book called Using Biophilic Design, Creating Positive Spaces. So you can download this from our website at oliverheathdesign.com. And it's basically a creative guide that outlines some of the amazing research and evidence that backs these ideas up. And then a series of different strategies that help you understand and integrate biophilic design and health and well-being into the built environment, no matter what your cost. And of course, we should be inspiring people. What's the business case? We've got to engage people and demonstrate that good design isn't just a nice thing to have, but an essential component, and that it makes real business sense. Now, over the years, there have been numerous studies about the benefits of health and well-being to the built environment, where it's been demonstrated to help cut costs, things like absenteeism, presenteeism, and staff turnover, but also to improve outcomes, things like productivity, creativity, communication, and engagement. Lots of studies. So this one particular study demonstrated that when natural elements are present, people self-report a higher level of well-being, a 6% higher level of productivity, and a 15% higher level of creativity. In the education environment, again, lots of studies, this one in particular showing that actually when students have optimized levels of light, it can increase the rates of learning, can improve test results and reduce absenteeism. In this study, even the use of natural materials like timber can help to reduce heart rates by 8,600 beats per day in classrooms. Again, lots more research in healthcare environments demonstrating that when patients have views onto nature, it can help reduce recuperation rates, and actually when patients recuperate in natural light, they can recuperate using 22% less medication. Now, these ideas are, of course, really important, and these kind of test results and these studies are essential, but what we do need to do is to implement them, to find ways of taking these abstract studies and finding ways to integrate them and sort of draw them out into three-dimensional designs. We are currently undertaking a project with a building research establishment where we're undertaking a 3-year study investigating the benefits of biophilic design at a low, medium, and high cost level, and hopefully demonstrating the return on investment. We're taking this building, Building 18, in the heart of the BRE Watford campus, and we're going to be investigating the quantitative and qualitative experiences of people in that building. We're then going to be undertaking a 3 or 4 month refurbishment based on those studies. And following that, we're going to be implementing these designs. So at the moment, what we're doing is we're looking at the results of these research studies. We are then separating the building into 3 different spaces and investigating how we can deliver biophilic design very simply at the low cost, the medium cost, and the high level, and also in a co-working innovation space in yellow at the end. So you'll see a few images of what we're doing. These are some of the simple spaces, the simple ideas, the medium cost ideas and materials, planting schemes, colors, textures, patterns, and also some of the higher cost ideas of how we introduce biomorphic shapes, patterns, some of the incredible technologies that our core partners are helping us to deliver, textures, materials. So we're integrating all these ideas. And of course, it's essential that we highlight to people that the road ahead is relatively bumpy. We're at the relatively early stages of how we implement biophilic design and health and well-being into the built environment, and it's important to recognize that there are hurdles we'll need to cross. Most of all, I think it's really about bringing people together, making sure that every stakeholder in the built environment process recognizes that they have a role. So it's about bringing together facilities managers, human resources, chief sustainability executives, financial operatives, and also design teams, and making sure that they all have a role to play and recognize that in order to deliver health and well-being, we've all got to be behind this idea and want to deliver it. And of course, that there are numerous other barriers to delivering health and well-being. It might be about some of the time and cost issues, about limited budgets, about short-term versus long-term. It might be about a lack of knowledge. There's lots and lots of research out there, but it's relatively abstract. And as a design profession, we're not really used to carrying out pre- and post-occupancy studies. And very often, we don't really understand the real benefit of design. Good design is not just about expressing messages going out, but making sure that the people inside buildings feel good and are able to be in a good physical and mental state to deliver on the activity that they're supposed to be. And of course, we have an enormous supply of existing buildings that do need refurbishment, that don't necessarily lend themselves, for all sorts of reasons, to being refitted for health and well-being and biophilic design. Biophilic design, I believe, is an essential component in the creation. What we do need to do is engage people in this conversation, make everybody realize it's something that's within them. And if it's within you, then it's probably within the person sitting next to you and the people that work alongside you. There are lots of positive reasons why we should be doing it. It's good for the design industry, it's good for building occupants, it's good for clients who get to experience financial returns, and of course that when we recognize that our health and well-being is intrinsically linked to the health and well-being of our environment around us, it leads us to a greater empathy and desire for the conservation of our wider environment, and that can only be a good thing for people, planet, and profit. Thank you very much.
Thank you very much, Oliver. Before I introduce our final speaker, this is your 10-minute warning. We will be coming to you with roving mics, so start putting together your ideas for questions. And if you've done your homework early, for recommendations, because that's a bit that's worrying me. We have to make this pragmatic and something we all take away. So can I introduce the last of our panel, Anne Aguilar, who is Director of Operations for IWBI, who's going to talk to us about being pragmatic. What does a well-being look like?
Oh, thank you.
You're welcome.
A round of applause.
Thanks, everybody. So Great. So I just wanted to talk a little bit about how our environment is changing, how we're working is changing, and we're looking at a different work-life balance. The work culture that we're experiencing today is extracting the best out of our employees by providing them with a positive experience and hoping to create an environment that's happy, productive, and stimulating. It's really important that we maintain focus and concentration throughout the day, and the imperative is to feel productive and happy. And we often forget that food is a major contributor to how we feel during the day. If you don't fuel your brain with proper nutrients, you will start to feel a variety of symptoms: memory problems, fatigue, and concentration problems. And there is a multitude of serious health risks today being connected with prolonged and excessive sitting. Sedentary behavior is still emerging in terms of science, but we know that sedentary lifestyles are causing as many deaths today as smoking. We've seen this statistic many, many times today, and we know that shelter is a basic human need, but staying indoors all day may feel and fuel anxiety, insomnia, and that all too familiar sense that humans just aren't meant to spend the entire day indoors. You miss a lot when you surround yourself with walls. Sunlight tops the list. Exposure to sun strength rays help calibrate your body's circadian rhythm, which regulates everything from your appetite to your sleep schedule to your mood and your energy levels. So we always believe that it's our genetic disposition that tells us what our health outcomes are, but actually, we have the opportunity to influence much more of our health through the design of the spaces that we inhabit and the health behaviors that we exhibit. You've seen this slide from Oliver. We really need to focus on the humans that occupy the spaces. They are the biggest cost factor inside our buildings. So the IWBI, the International Well Building Institute, is the guardian of the well building standard. As Oliver mentioned, the standard was released in 2014, which came on the back end of 6 or 7 years of research that finally put together the academic background, the architectural background with the medical background, and really had to ask the question, if you could design buildings today, to really improve the health and well-being of the people inside those buildings, how would you look at the design of those buildings today? So we released Well version 1 in 2014. We released Well Community at the end of 2017, and most recently released Well version 2 in 2018. And what's really exciting about the movement to Well version 2 is that we have a One Well portal, which means that all of the different variations in building typology can be delivered through this Well platform. So if you're looking to provide Well certification for an office environment, a multifamily environment, education, hospital, or healthcare, you can use the One Well standard that will actually become a dynamic, evolving scorecard that really talks about the typology of your building. So we've changed from the 7 key topics that Oliver mentioned to now expanding those and including 10 main key concepts to look at well for the built environment. So we still have air, water, nourishment, light. Fitness has been changed to movement, thermal comfort, sound, materials, mind, and community. And what's really important about this position of Well version 2 is the belief that well is the second wave of sustainability. So we have tried really hard to work with all of the sustainability frameworks to create an alignment and a crosswalk with each of these tools to make sure that sustainability and health are an aligned platform for buildings. So why is well an important topic today? Well, if you start looking at the statistics of people who have actually started to occupy these buildings, owners of these buildings see that it has a positive impact on the leasing rate, it's got a positive impact on value, but more importantly, it's got the highest occupant satisfaction, which is that people are feeling better and happier in these spaces. And what are the benefits that we see? Well, obviously, for employees and clients, the benefit is that they are now living in a health-focused environment. There is increased productivity and happiness at work. But for the company, what we're seeing now as our earliest adopters of the Well Building Standard are folks that really want to be seen as pushing the boundary in this discussion, the innovators, the ones who are trying to attract and retain the best talent out there. And what you'll start to see is that the awareness of these issues is growing. In our homes, homeowners now understand that there are products in our environment that can make us unhealthy. So there's a greater awareness and a greater reaction to encouraging and being aware of the kinds of materials that we're specifying. Our priorities are emerging. The Velux Group published a Healthy Homes Barometer reporting on customer attitudes across 12 European countries. And people realize that in order to design houses that are healthier, we need to take these really strong concepts into consideration. Most homeowners now are actually willing to pay a premium for a healthy home and healthy home products. In both of these cases, homeowners from ages 50 and over are always willing to pay more for their homes. 70%, over 2/3 of consumers, are considering this healthy indoor environment as a precursor to the purchasing of their homes. And this is a really interesting case study. Australia's largest residential developer joined a partnership to create a company and development called Salandra Rise. This is a demonstration project that focuses on the principles of health and well-being and starting to provide diverse and affordable housing options and employment. The cost of the wellness components on this development was only 1% to 2% of the total project cost. So we're now moving from a commercial office sector in well into multifamily residential. We're seeing residents that are looking for health-focused environments with a real positive focus on health, and they want to walk away and feel that they are getting improved energy and better quality of sleep in the residences that they live in. For the developer and the property owner, they see an increase in value and a recognition that they're addressing a market trend that's very, very prominent. But what I really want to focus on today is the most important aspect of WELL, which is what I believe is the real differentiator, which is that WELL is all about performance verification, which includes rigorous testing of the building's spaces, air, water quality, contaminants, lighting levels, and acoustics. The WELL plaque is like a nutrition label for your building. It tells you what you're getting in all of these key areas, and it's not just about designing to the standard, but it's being able to understand that it's been tested and validated so that the building you're in meets the criteria that we have set. So what you're finding is that instead of just the label, you're actually getting the assurance and the confidence that all the tests that we require are actually met during certification. So the global movement at this point in time, as Oliver mentioned, we launched the product in 2014. We now have over 1,500 projects in 48 countries with close to 311 million square feet. 25% of those square footage totals are actually here in Europe. So thank you very much, and please consider getting on board and joining the movement. Thank you.
Here come the microphones at speed. Okay, you know what I want? I want hands in the air and volunteers. Your name, your organization's name, question, and who it's addressed to. Who wants to go first? Gentleman in the middle.
I just grabbed my pen. Sorry.
Hi, this is a question for Oliver. My name is Adam Jones. I work for Kier Construction. You're undertaking this kind of human guinea pig experiment with people within the offices relating to their well-being. I work in an office which is very varied from one side to the other. There's about 800 people. One is quite a open plan office, and the other side of the office is more segregated. And when you go to offices generally, there's lots of different nuances relating to them. Have you thought about pushing this experiment a little bit wider and getting other companies and your peers involved in putting together data that might be more representative of offices that are already built across the country?
Well, at the moment, one of the interesting things about the BRE project is that it is in an existing office building that is actually very similar to lots of sort of medium-level existing buildings. So I think there is value in it immediately. So we are dealing with an existing concrete frame building with a variety of aged technology like lighting and ventilation, probably sort of relatively low quality glazing that's sort of been shot. So there are similarities to be drawn from it. We haven't at the moment decided to kind of link with other office buildings, in part just because of the timeframes, and in a way it's just hard enough to gather together the core partners and the structure at the BRE to do our own project as well as engage with others. But hopefully what it will do is start to demonstrate the return on investment of these different strategies, which can then be tested in other ways by other offices around the country. I think whenever you do a study, you're going to be under scrutiny because of the sample size or the time or the budget, or, well, you know, this isn't the same as another building in another location. So what we do have to our benefit is that it's a very long-standing test in that we're able to do it for a year before construction and a year after. We have the resources, the BRE, which to do with the measuring of light and temperature, humidity, air quality. We've got a fantastic team doing the qualitative studies as well. So we have got sort of kind of rather unusual set of resources that we can draw on, which I don't think would necessarily be available at every other space. Having said that, I would hope that it would inspire a level of pre- and post-occupancy studies to be happening everywhere. Because whilst I mentioned that we do have all this research, it's all abstract. It's all happened in another building, in another country, at another time. And really what we need to be doing within the built environment profession is kind of creating a baseline before we go in and do a project, doing the project and then measuring it afterwards, and really getting some kind of some relevant feedback about the services that we offer and the designs that we implement. So hopefully it will inspire a little bit more of that sort of broader level design thinking.
Thank you. Having visited Garston, I can confirm it is an ugly office block. And actually, using people who do research to do research seems like a win-win to me. But great question. I'm going to look this direction, to the far right. Any volunteers? You're all looking shell-shocked. Gentleman at the front in the green shirt.
Thank you. Thank you. I was Robin Nicholson, Cullinan Studio. I was really interested in Emma's figures about the low temperature at which deaths start happening and the speed with which they happen. One of my lives is chairing the Cambridgeshire Quality Panel, which oversees all the housing that's being built in Cambridgeshire, which is generally much higher quality. But the one area which house builders appear not to understand is about overheating in houses and how it's relatively easy to design it out. So my question to you is, how do you approach the house building industry as Public Health England in the light of healthy new towns?
Yeah, really good question. There does seem to be a real gap between what we see in terms of the impacts, the likely risk going forward in terms of climate change and future-proofing new builds, never mind existing buildings. Our engagement with the construction industry and the Ministry for Housing and Local Government is, as we're trying to approach it from all angles. We're linked really closely with the Healthy Places team, who lead within Public Health in England on healthy new towns. We're also working in that cross-Whitehall group to try and influence the regulations, and we work within other groups. We're linked with the climate change risk assessment to keep pushing from that side. And one of the core things we need to do is around building the evidence base, because if we can cost those health impacts, it has a much bigger impact on government if we're able to say, this is the cost of the health impact and these are the costs of the interventions that you put in place. And I think that that's probably the multi-pronged and strategic approach is probably where we're going to gain the most traction. But it's taken us a really long time to even get it up on the agenda. And the reason why I mentioned the climate change risk assessment is because that's actually been a really, really useful tool for us for raising the profile of it. Even though the climate change risk assessment is in theory talking about a future climate, actually the evidence has demonstrated that the problem is happening now as well.
Thank you,
Does that
Robin.
answer your question?
Thank you. I'm going to come here. Excellent. I volunteer.
Hi, I'm Kathy Gibbs. I'm a design and management consultant, and my question is directed mainly to Anne-Marie, who knows me. I am aware of WELL standards, but not the details, and I think there's probably a need for a WELL standard for culture. I don't know if it is already covered, because I think WELL probably covers things that are easy to measure. I'm coming from the point of view, I'm wearing a Fitbit. It tells me that every hour I should be moving 250 steps every hour. But in this forum, for example, we can't do that. And most of us at work or who have to sit through long meetings will never have that opportunity. And that's just one example. So I kind of feel that there's a need for also something held like my business culture, achieving the standards we want to achieve. And can you answer whether that's something that's also being looked at or also encompassed in any of your standards?
It's a great question, Kathy. It's great to see you after all these years. I think that if you looked in detail into the mind category, I think we're trying to work really closely with HR teams, and I think we've all mentioned now that like the great aspect of talking about health and well-being is that we can start to bring the HR team into a corporate real estate discussion for the first time ever. And I think it's about changing those policies to allow the HR team to understand that we need to get more movement, more freedom for accessibility, allowing people a different structure around their workday, not giving them a sort of HR package that includes a gym membership and says, go off and take care of yourself. It's, well, no, how do we actually evolve exercise and movement when it's convenient for you, not just convenient for the office? So I think WELL does, for the first time ever, look at the mind category as a way to sort of build a relationship with HR and to allow things like even connections with personal Fitbits and find a way to sort of digitize what's happening in the work environment so that people can actually feel progress and feel like they've done something. So I think if you look into that section and even the research that sits behind the mind concept, I think you'll find a little bit more detail about that.
Thank you.
Thanks.
You know where I'm coming, and I have another volunteer. And you guys are next.
I'm Mohammed Ashur, architect, director at the Places of Architecture. My question is for Oliver. In the well-being standard, you mentioned the 7 concept about the light. I think the big challenge in using natural light to have good health and well-being is the glare control. We know that the natural light is changeable, so my question is how we control the glare. Is it by using materials, furniture, or color within the indoor environment? Or should we start thinking about the glare control from the design stage? Thank you very much.
Well, I imagine Anne-Marie's got maybe a few things to say as well. I would imagine that the earlier that you can consider any of these features, the better. So the more that you can consider air quality, water quality, food, and also light right from the outset, the better. Obviously, if you can prevent excess direct sunlight coming in, then you'll prevent excess thermal gains as well. So maybe exterior shading. Mm-hmm. I guess there are a number of ways that good design can do it. It may be about reducing glare from natural light, but also artificial light as well, which can be exhausting. So I guess going through it and making sure that that design thinking is considered right from the outset.
Yeah, I guess I would just add to that looking at the biophilic opportunities in terms of shading devices, I've seen some really beautiful ways of, you're trying to get as much natural daylight in, but at the same time trying to prevent all that uncomfortable glare. And I've seen beautiful patterns of different types of shading materials that allow some transparency and give you that glare control as well. So I think it's looking at all these new materials that are evolving, and they're really based on these amazing principles of how does it look natural and bring you the same overall benefit of natural light, but give you that protection.
Thank you. Gentleman here, then lady in white.
Hi there, Ali from Renovate Contractors. Just a quick question to Oliver. Would you recommend a biophilic design to, in a 3-story college to be built essentially? And you speak a lot about nature. So, would we have the structural sort of layout and the formwork or the framework, made from timber, glulam, bamboo? How structurally sound is this? How safe is this if you're going to be building it in a school, labs and whatnot? So I'm thinking more about the safety element rather than just the health and well-being. What do you recommend? Feel free to answer. Thank you.
Well, we are seeing more and more buildings being built out of glulam timber beams. It's worth going to have a look at the One Planet Living Centre by WWF in Woking. It's a really beautiful glulam building. Very inspirational, lots of natural light flooding in. There are, without doubt, lots of ways that you can overcome the fire issues with timber. So I wouldn't kind of rule that out. Am I right in thinking there's been a restriction of height now with timber buildings to 7 stories? Is that right?
That's the number that just jumped into my head.
Yeah, I think
too,
so. So the government has decided that, but I don't think by talking to the industry. So I think there's lots of knowledge and research out there that is probably surpasses what the government is thinking. But incorporating biomorphic shapes into the structure can create a very harmonious building. So take a look at the WWF building. It's a real inspiration.
Okay, I have 3 at least, and then I'm probably going to ask all of you to come up with recommendations. And if any of the 3 people, who's lady in white, lady in purple, gentleman at the back, have a question for Charlotte, she's feeling underused and unloved.
Oh, I'm fine.
Apparently she's not. Lady at the front.
Hi, my name's Joanne Reynolds. I'm from Living Gaia Ecology. Biophilia is all well and good inside the buildings, but from the construction industry and from what I see, construction people seem to think that it's okay to build a great big concrete jungle and plonk a few trees in, and that's going to make us all feel better. There are no wildlife corridors. There's nowhere for foxes and badgers and insects, and as we all know, the insect population is starting to crash by 50%. Is that something you're going to look at in the future, to biophilia outdoors as well as indoors in cities?
Oliver's looking
me, I guess.
stunned.
Yes, so I mean, it's a subject in itself. It's green infrastructure, GI. And there's quite an interesting stand I'm completely disorientated, just over there, all about trees and how an organisation that's bringing trees into cities, and it helps people specify the right trees for certain types of light and space and air and kind of soil type. It's not, no. So, I mean, this idea of urban planning, I mean, biophilic design can happen from something as small as a plant on your desk to a green wall system, to the exterior architecture of a building and how we integrate plants. You know, you might want to look at the Bosco Verticali in Milan, beautiful kind of tree-strewn building, or some of the buildings by WHOA in Singapore. I think more and more we are waking up to how modern buildings and cities have tended to shun nature and say, you know, we're the built environment, it's all about keeping nature out, and now we're recognizing the amazing benefits of bringing it in, and recognizing how we do enjoy being near it, how it is beneficial for us, and how we also have a responsibility to greater wide environment and biodiversity. So I think that is starting to happen. Apparently cities like Singapore purport to being cities in a forest. So they are recognizing the importance of bringing nature in. That's what they say. People who go there still say it's noisy, messy, and overly developed. But we are starting to see cities recognizing the enormous importance of bringing nature corridors and elements of nature right in. And also, I mean, in a smaller scale, the value of parks and green spaces in our cities today.
Thank you. I've had a big red screen, so second last question.
Sorry.
Hi, Nicola Branch. I'm wearing two hats at this particular seminar. One is as an energy advisor with Shine London, with the Seasonal Health Interventions Network. Obviously, seasonal health, not just cold, but obviously the heat. And we have been involved in climate change heat panels in London. Also, I don't know if people know, but the Bun Hill 2 project is basically taking waste heat from the underground, because obviously a lot of people are very hot on the underground, and we are using that waste heat in Islington to provide power for houses and schools and shops. And London Underground are looking to develop that throughout the rest of London. Taking my work hat off and my personal hat, cycling, I think, is very important indeed. I was quite shocked at the 100 million people living above the 55 decibels threshold. And I should think that the 18%, I'd love to know where the 18% of people are. I should think a large number of them are in Holland. Or Copenhagen. I really do think, and this comes back to other areas around mental health as well, I think it's so important we've really got to move away from the private car to bicycles. And it's not just fit people that ride bicycles. If you think it's just fit people that ride bicycles, look up Wheels for Wellbeing. They're a fantastic charity that work with people with disabilities. A lot of people with disabilities use bicycles as an aid to get around. I'm really pleased to see Cycle Hoop over there. Nice little wave there. It's so important moving away from the noise and also heat. And I think you mentioned about solutions. I think that's got to be up the top there, because it also affects mental health as well. As somebody who lives with really bad depression, I've suffered horrendously from noise pollution. And I'm well aware that cycling is actually good for mental health as well. So I think...
Thank you. More of a statement and a plug, but still beautifully put. Gentleman here, last question before I need recommendations.
Hi, thanks very much. Martin Foder, I'm a member of Bristol City Council, part of the Green Group of councillors there. I appreciate everything that's been said about heat, noise and the WELL standard, but I think most of it's been mentioned in the context of the WELL standard being for corporate projects, and I'm interested in the cost and the complexity and how it can be applied to low-cost housing, large-scale projects, more affordable projects for like more people, and sort of public projects. And if anything, there's a recommendation. Should there be a simple version or a basic version that actually works for large low-cost housing projects and things like that? You can get great design, great construction, built to last on social housing, but how can this be applied to things like that? Because the pressures for millions of new homes are enormous. So how can we apply it there?
Okay, very quickly I'll allow Anne-Marie to come in.
I would just say that, part of our vision of WELL version 2 is to address things like social housing, education, and public sector. So we've launched a 35% discount across the entire WELL building standard for registration, certification, performance verification, simply to address that sector. So I really appreciate the question, and we're really addressing very seriously trying to move our focus away from, well, we know that the commercial office sector is up and running, so now it's about time to get into the social housing sector. That's our primary concern.
Okay, thank you. Right, quickly, anybody want to volunteer either recommendation 2 or 3? I'll look at the audience first, then I'm going to quickly down the panel. Not a single one. Excellent. The speakers get to sing for the supper one last time. So starting with Emer, suggestion for a recommendation that we can take away.
I think I'd stick with my opening comment, which was around the need to look at all of these things in the round, and the need to make the connections explicitly around all those various things, both within the home and outside the home, that lead to health, not just protecting health, but health promoting environments. And underneath that, I recognise that there is a real gap around how we make that happen, and a lot of it is to do with cost, attaching financial figures to the benefits as well as the costs, and that relates to the Bristol question
Return on
too.
investment. Great. Yeah. Charlotte, you get to talk.
Sorry.
Hello.
I'm with Oliver. I do a lot of research myself on projects I work on. I review evidence and try and apply it. And I think what I've come across is there's a big fear from designers that they don't want to do post-occupancy surveys, or they don't want to measure health. Health is seen as something scary, can't be measured. It can be measured relatively simply. You can do surveys. I think there's a fear that you might not find what you want to find. But actually, that's the wrong thing to fear, isn't it? Because if that's what you do find, it shows that you're actually peddling the wrong thing. So I think we should embrace actually trying to be a bit more reflective on what we do in that way.
Oliver.
I think it's to encourage people to understand where stress exists in buildings, and look at how we can mitigate that through good design, and equally to understand the spaces where people go to recuperate from physical and mental activity.
Thank you. Anne-Marie.
I guess I would probably say to not be afraid. People assume that to look for WELL certification or anything that delivers performance testing at the very end, which I think is really critical, is too expensive, too costly, too time intensive. And I think we need to start realizing the importance of the data that we're collecting and how this invested time and money is really of huge value when we look at the amount of time that people spend inside the built environment.
Okay, that's great. I think I have a holistic approach, well, for every sector, every size, not just corporates, identifying what we mean by stress and well-being when applied to buildings. And I've put down as the answer to the question, what to tell government, we need to present a real ROI for why we need healthier, better buildings. Does that sound about right? In which case, 7.38 minutes over. Thank you very much to all of you for some great questions, and thanks to our speakers.